Well, for nearly 2 weeks, it looked like COVID-19 case numbers in Thunder Bay might finally be trending downwards. There was a spike again yesterday, though. The Thunder Bay District Health Unit reported 32 new cases of the virus yesterday, bringing our total number of active cases back above 200 again. As well, as of yesterday, the health unit had identified 4 cases as variants of concern. Here to talk about the latest developments is Dr. Janet DeMille. She's the Medical Officer of Health for the Thunder Bay District. Dr. DeMille, good morning.
Good morning, Amy.
So I mentioned some of those latest numbers. In terms of the larger trends we've been seeing over the last week or so, what's the message you want people to take from the numbers?
Well, we have certainly since the beginning of March experienced a fairly substantial decrease in the number of cases, and that key measure that we follow is the cases over the last 7 days, and we did see a fairly substantial decrease in that. Unfortunately, this week we seem to have sort of more stabilized around. And sort of stopped that decrease we were experiencing. And we've stabilized. I look at it for the number of new cases in the past 7 days, and we seem to sort of be around 110. So, and that's in contrast to the beginning or the first week. At the end of the first week in March, we were around 270. So you could see that drop was there, but it's sort of stabilized, and it's stabilized, or it is, at least in the last few days, at still a fairly high number. Like, it's still over 100, and there's still a ways to go. However, I think it is important not to look necessarily at the day-to-day numbers, because there's a lot of things that can influence on a daily basis whether that number is sort of higher or lower, and depending on testing, the kinds of things we're seeing in the spread and things like that. So, I think there's still, still sort of optimistic that with the measures that we have in place and the sort of the gray zone that we're in, and hopefully people, really being mindful of all of those public health measures to reduce the spread in our community, that we will sort of continue to see that drop. Of course, you mentioned the VOCs, though. Yeah. So, and we are now reporting that on the website, so our website, so you can check. So out of, we've all our tests, by the way, are screened for the mutations that would be indicative of variants of concern. And we've only received 4 sort of positive results on that screen. And that actually overall is fairly good. However, what we see happen in the rest of the province and also other parts of the country is the VOCs are spreading, and they spread quicker than the regular coronavirus variant that we would normally see. And, we see it driving the increased case numbers, especially in other parts of Ontario. And that does put us at risk. And so what happens over the next week or two or more is going to be quite, it's uncertain.
I do want to come back to those variants of concern. But first, when you say that the numbers have kind of stabilized, they were going down and now we're hitting this plateau at this point, any idea as to why that is?
I don't know if I could really say why it is. I think maybe, we're, it's hard to say. We do see, a few clusters of cases here and there that, that might sort of be increasing our case numbers this week. But I think we're still seeing COVID-19 in various different places, and it's spreading. It's spreading to household, like people in the same home, people, if there's people who might be getting together or sort of interacting with one another, we're seeing that spread. So, there's no particular reason. I think it's just that ongoing effort to really bring these numbers down.
So going back to those variants of concern, what is known about how people in our area have acquired variants of concern?
So for 2 out of the 4, we do know. where they likely got it from, and one in particular was somebody who clearly had come from outside of northwestern Ontario and returned back here, and so that brought it in from somewhere else. But the other ones, we don't necessarily know where they acquired it, and that does raise the concern that there's that maybe there is more there's coronavirus here that we haven't detected, and that that it could be spreading.
And we know that those variants can cause more serious illness. CBC has reported on provincial data suggesting variants are associated with a much greater risk of needing treatment in the ICU. They increase the risk of death by roughly 60%. What are we seeing here in terms of how seriously these variants are impacting the health of those who are infected?
So I am not aware that any of these individuals was sort of particularly ill. I know that we haven't had any individual with a VOC require hospitalization at this time. So for some people, the VOCs may not really cause anybody to have, a greater illness. But certainly what we see is, and as you're correctly identifying, is, with the rise in case numbers in Ontario, there's been an increase in hospitalization and an increase in ICU admissions.
Mm-hmm. In terms of the testing, you mentioned that all cases are being tested for the variants now. How long does it take now to test for and diagnose those variants? Because I know there was that lag that we've talked about before.
Yeah, so the testing process actually has changed and has been updated. So all our tests are now screened for 2 different mutations that could indicate a variant of concern. Before it was just one, so that's sort of an enhanced surveillance. But they're not necessarily going on for that fancy test that would be needed really to confirm the type of variant. So I think it's just knowledge around the variants of concern and how to test them, how to accurately confirm whether somebody does have a VOC has become much sort of more efficient and guided by the get evidence and lab techniques involved. So we actually so if somebody tests positive and let's say we find out about it today, I think it's about 4 or 5 days, if not sooner, that we would get that screen result back, and then they don't have to go any further for any follow-up tests.
4 or 5 days, though, still a significant amount of time. For you, as you're trying to make decisions day by day about the health measures in our area, how challenging does it make? What kind of challenges does it pose for you when you're waiting for that information?
So I think what we're doing right now is just applying enhanced public health guidance that was developed over a month ago, even 2 months ago, for the variants of concern. So recognizing that posed a risk to Ontario, the guidance was sort of strengthened around how to manage any case or in case they had a variant of concern. So we continue to apply that enhanced guidance as we work with individuals who have COVID and the individuals that they may have been in contact with.
Sadly, over 50 people in the district have now died from the virus. Initially, the deaths, as I understand, were mainly among elderly people or people with health conditions that made them vulnerable. What are you seeing now? Has there been any kind of shift there in terms of the demographics?
We're very much seeing the same thing. So what the people with underlying health issues and people of older age are the ones that are more likely to require hospitalizations and even die of COVID-19. And we drew the statistics yesterday. So we've had 26 individuals, unfortunately, pass away as a result of COVID-19. And their average age was actually around 74 years of age. Unfortunately, we did have at least one individual in their 40s who did pass away. And out of the people who've been hospitalized, and that's close to 130, the average age was 56. And again, there was quite a range there, including an individual in their 20s.
I also want to talk about the vaccines. So can you bring us up to speed on the vaccine effort? Because we'll soon be heading into phase 2, won't we?
Yes, and actually we're very actively preparing for the priority groups that are listed in Phase 2. In fact, and which, technically begins, I guess, today on the beginning of April. But I think it's more of a transition, and certainly anybody who was eligible in Phase 1 remains eligible. So if you haven't received your vaccine and you were one of the groups in Phase 1, absolutely, please consider getting it. And so as we move into Phase 2, we're looking at different age groups sort of going down lower than 80. Obviously, we've already started that in 5-year increments. We're looking at individuals who have underlying health conditions that may put them at risk of greater complications if they have COVID. And that group is divided into 3, those at highest risk, those at high risk, and then those who are at risk. We'll also be looking at other congregate care living type settings. So we've done the congregate settings for seniors like long-term care home and retirement home, and now more broadly those congregate settings will be included in Phase 2. And then there's a large group of people that are essentially the essential workers, I guess, those individuals who can't really work from home.
Well, speaking of those groups eligible in Phase 1, I know there have been a lot of questions about vaccine rollout and eligibility. One criticism that I know we've heard of the health unit is that the vaccination process hasn't yet been opened to adult chronic home care recipients who would have been eligible in Phase 1. What's the timeline for vaccinating people from that population? So
actually, almost, I think it was over 900 of recipients of chronic home care were immunized. I think it was either last week or the week before. We worked with the home and community care at the local health integration network and did get them in the hospital, did it at their clinic. However, what we're looking at now is individuals who are really unable to make it to a clinic. Perhaps they're homebound or have restrictions that make it hard for them to leave the house, and looking at a process of being able to do home visits and provide the immunization.
There's so much going on. There's so much we could talk about. But as we head into the Easter weekend, Dr. DeMille, in just the clearest, simplest form, what is the message that you want to get out to people about how they need to behave over the Easter holiday?
So it's still different this year. COVID-19 is spreading, and if people, we could spread over the Easter weekend. We know people like to get together to interact with family, and we're really asking them not to do that this year because it could spread COVID. So connect in other ways, like electronically or by phone. Please, this year, we have high rates still here in the Thunder Bay District. We are at risk with the VOCs, and we have to hold on with those basic measures that we've always talked about.
Yeah. All right. Well, we'll leave it there for this week, Dr. DeMille. I do hope you have a good, safe Easter. Thank you for joining us.
Thank you, Amy.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.